everyone, welcome to GrowMed. Today in this session we are going to discuss certain medicine clinical cases which were asked in the past exam. So the most commonly asked topics we will be discussing here today, the buzzwords of the clinical cases, so that it will be easier for you to find out the exact answer in the exam. So this will be small 5 to 10 minute sessions which you can watch it during your break time, during your tea break or coffee break, or whenever you are uh, feeling hectic about the studies. That time you can just watch these videos. Okay, so let's start our discussion. So the first question, these two questions were asked in the recent exam. That one is the July 25 exam from the medicine. So we'll discuss it. So a patient with mitral stenosis was present, and along with that he also had a complaint of atrial fibrillation. So what JVP finding can be seen in this patient? So it is quite easier question. So whenever you think of atrial fibrillation, we know that it is associated with this A wave. So absent A wave, this is the JVP finding, because A waves will not be there in case of atrial fibrillation. So let me make it easier to you. On the ECG, what findings do you see in the atrial fibrillation? Yes, it is the absent P wave. That means the atrial contraction is very minimal in this case, atrial fibrillation. Okay, so that's why these P waves are not seen properly. So similarly, you can correlate it with the JVP as well. As your P waves are absent, so A wave in the JVP stands for the atrial contraction. So that's it is not significant. So that's why A wave is absent in case of atrial fibrillation. So like this, you can correlate it and solve this clinical question. Then moving on to the next question, a patient with chest pain presents to the casualty, and you perform an ECG and you see these changes, ST elevation in the V1 and the V3. What is the diagnosis? So definitely it is a kind of an MI. Okay, so what kind of MI? It is the anterior wall MI. So this was asked, this exact thing was given in the options, anterior wall MI, because leads V1 and V3 are involved. If it was something like V4, V5, then it will be the, I'm sorry, if it is V1 to V4, it will be anterior wall. So if at all V5, V6 is involved, then it will be something like the lateral valve. And if you see the changes, something like this will be described in the clinical case, V7 to V9, then it will be the posterior. And if it is 1, 3, 2 lead 2, lead 3 and AVF, then it will be the post inferior wall MI. So frequently asked in the exam are this inferior wall, anterior wall and the lateral wall MI. So they will be giving you the leads and they'll ask what wall MI is there. So then moving on to the next, another one thing I want to tell you here is they can also give the ECG. Image based question can be given in the ECG and they can ask you to find it out. Okay, so be ready for both kind of the questions asked. Then moving on to the next question. So a quite lengthy question. This was asked in the NEET period, the recent NEET exam. In that this question was asked. So let's have a look at what all things you must look into this. 35-year-old non-smoker. Okay, then history of dry cough and progressive dyspnea was there, and something like over the 2 months was described in the case. So chest X-ray shows bilateral hilar lymphadenopathy and non-caseating granulomas were seen. Then stellate inclusions were also seen, epithelioid histocytes and multinucleated chain cells on the uh, biopsy. So this is the things described in the clinical case. So whenever patient comes with this, we think in terms of the respiratory causes. Okay, so but in this case, as there is non-caseating granulomas present, so it is directing us towards something like an autoimmune disease, which is the sarcoidosis. Okay, so this one is the answer for this one, because these things will be seen in case of sarcoidosis, the bilateral hilar lymphadenopathy, and the patient is also a non-smoker. Okay, so if it was a smoker, then we could have thought in terms of some other things, but it is a non-smoker and a young patient, so definitely associated something with the immunity, autoimmune disease. Then moving on to the third question. So a patient with history of viral infection 2 weeks ago. Now presents with complaining of acute ascending bilateral symmetrical lower limb flaccidity followed by upper limb weakness. So what will be the diagnosis? So in the question itself, if you break it down, the answer is given. So first of all, it is an acute condition. Okay, so acute inflammatory demyelinating neuropathy was the answer. So the other name for this one is this Guillain-Barré syndrome, a famous question topic asked in the Fmge and the NEET PG. So it is a very favorite question, favorite topic of the examiner. So questions are frequently asked on this Guillain-Barré syndrome. Okay, so if at all you have read about this Guillain-Barré syndrome, then you can associate it with that. It is associated with the uh, ascending bilateral symmetrical flaccidity is seen with this Guillain-Barré syndrome. So the another name for this one is the acute inflammatory demyelinating neuropathy, which was given in the option. So this one will be the correct answer. If at all Guillain-Barré syndrome is given, then you can choose that also as the option. So this was another thing, important topic from the medicine. Then moving on to the last clinical case for today's session, that is the 17-year-old male was there. He came with the complaints of proteinuria more than 4 gram per day, and along with that complaints of edema, hypoalbuminemia, which was consistent with a nephrotic syndrome. So the diagnosis itself, they has given that the patient was having nephrotic syndrome. So the question asked was the next step of the management, and in the option there are various things given like IV steroids, then diuretics and cyclophosphamide, something like that. So from here the answer is this steroids. Okay, for the nephrotic syndrome usually the management is this steroids. Okay, so a quite easy question. And nephrotic syndrome, noted down again, a repeat topic. You can expect a question from this nephrotic or the nephritic syndrome in the upcoming January exam. So that's all in this video. We have discussed 5 important clinical cases from the medicine. So in the next video, I will be sharing about either surgery or OBG, similar buzzword like this. So for more videos like this, subscribe to GrowMed if you're new to GrowMed. Like the video and share it with your friends, and all the best for the exam. I am Dr. Padmini, your mentor for the Fmge. And for the PDF, you can join my Telegram channel. I will share the PDF there. The link is given in the description box. Thank you so much once again. Bye bye.